Welcome to our video. First, please hand sanitize. After, you'll don your PPE, starting with your mask, making sure it covers your nose and chin, your eyeglasses, and then your utility gloves. After donning your PPE, you're going to proceed to use paper towels and clean all hard surfaces. This includes the top of the cabinetry and the X-ray viewer. Please make sure to include all handles as well on the cabinetry. You'll see she's cleaning the doors. Remember, we are cleaning prior to disinfecting, which will remove any gross debris, such as blood, saliva, plaque, or any other materials. If you ever happen to drop a paper towel, please ensure that you pick it up to throw it out and get a new one. After the cabinetry, you'll proceed to the stools, both operator and assistant, and you'll clean all surfaces that are not light blue with the Birex. The light blue upholstery on the chairs will actually be cleaned with soap and water. The Birex can crack and discolor the material, therefore only use this on the beige and black areas. Make sure you are including all feet rests, as well as the spindles on the bottom of the chair, and you will also clean the handle, the adjustment levers. Making sure to replenish your Birex by getting a new piece of paper towel and soaking this as you proceed. Ensure that your paper towel does not dry out. If it does, it is more difficult to actually remove the debris, especially if it has dried onto the unit over time. When trying to clean the base of the chair, it may be easier to place it in an upright position, meaning higher up off the floor, and you are going to be cleaning right down to the actual floor, so the true base of the chair. Make sure to clean the rheostat as well as the chair adjustment pedal. You'll notice all tubing is also cleaned. This can harbor a lot of microorganisms as well as dirt from rubbing on the floor. Once the chair has been completed, proceed to the top of the light. You will be now working from top to bottom on the dental unit. Make sure to clean all of the arms. You'll also clean the handles on the light and all levers. Please do not use Birex on the shield or the reflector, which is on the back of the light. We will show you how to clean this shortly. In order to clean the shield, what you'd like to do is actually grab the ivory soap, run the water, and actually plug the sink and ensure that you have a nice soapy water. You're going to use this not only for the light, the shield actually on the light, but you're actually going to take the soft paper towels now, and you'll be doing the light as well as the chair upholstery. The chair upholstery consists of all the blue portions on the chair. Once again, you are still cleaning, you are not disinfecting. So this is removing any gross debris. The disinfection will happen after. When you're cleaning the base of the chair, there is a plastic barrier that covers the footrest area. Please ensure that you remove this after you've cleaned on top to actually fully clean the blue upholstery on the client chair. a lot of dirt and debris can get wedged in between that plastic covering and the actual chair itself, especially in times of, for example, rain, sleet, snow, anything like that. With respect to the light, there are two clips or two levers on the sides of the shield. You will flip those up and you'll be able to remove the shield off the light itself. Please bring it to the sink, once again using soft paper towels and the ivory soap that's in your sink. You will wash the outside of the shield. Because this shield is covering the light and in direct view of the client, you'll want to make sure that you wipe this soap residue off of the shield. Once it is wiped off, you can replace this by placing it onto the light and clicking those levers down. Ensure it is secure prior to pulling off. The reflector on the back, use just water, not super soaked, when the shield has cooled down to wipe it off. If it is hot, it can cause cracking. Going back to Birex, we are now going to work on the bracket tray and then the suction area. When you're cleaning the bracket tray as well as disinfecting, please remove the rubber non-slip material that is on the top of the bracket tray in order to both clean it as well as underneath. You will then proceed to clean all beige surfaces. When you're doing the air water syringes and hand pieces, make sure not only you are doing the actual syringe itself, but also the tubing and the holder. The reason for this is a lot of debris, once again, can collect on the bottom of the tubing as it may rub on the floor as you're working. Make sure the hand pieces are off of the tubing prior to disinfecting, as they will be sterilized. But again, ensure you are cleaning within the holder, the tubing, and the coupling itself. The holder is one of the most frequently forgot areas. Always ensure you get the handles as well. Proceeding down the area by the cuspidor and suction, once again you are cleaning all beige areas. Clean around the cuspidor, all of the water switches, as well as the water spouts and the water bottle. Inside the cuspidor can be quite grimy, so what you're going to want to do is make sure that you're going to clean inside, as well as remove the trap. You're going to take this over to the sink, rinse it very thoroughly, especially if they've used something like disclosing solution and it's accidentally been put in the sink and can cause staining. You'll definitely want to be rinsing that out as soon as possible. When cleaning all suctions and suction lines, once again, do all of the arms attaching to the chair. You will do the outside of the suction as well as the tubing, the holder, and then you will actually disassemble the suction and use some brushes to clean inside. You will proceed and actually clean all 4 of the suctions and air water syringes if they are on there. For the purpose of this demo and for timing, she is demonstrating only 2. If anything happens to fall, which it does after you clean it, please ensure that you actually re-wipe this down. Now what we will demonstrate is how to remove the metal portion from the section, you will pull it apart. There's an O-ring that helps it seal. There is a large wire brush that we'd like you to clean the inside of the high volume section, the metal piece, as well as the rubber tubing. And then you will replace it. Ensure that you securely click this onto the tubing. If anything happens with the O-ring, which is a black ring that is on the outside of this metal portion, please ensure you let Julie know so that it can be replaced. There's a small wire brush that you can actually use for the saliva ejector, and once again you are going to be cleaning both inside the top metal portion as well as the part that it's attached to the tubing. There is also a main suction track. You will want to remove this from the unit. Once again, rinse it very thoroughly and then replace back into the unit. Ensure that you press quite firmly to ensure it is secure and you don't hear any leaking suction sounds. You may have to rotate this in order for it to be secure. You will have approximately a liter of Dentazyme in this jug. What you need to do is take all of these sections in 5-second intervals and place it in and out of the suction solution. This is going to disinfect the inside of the tubing. When you are finished, you want to make sure that you turn off the suction when it is inside of the solution. The reason for this is it will trap the solution inside of the suction tubing, which helps allow for disinfection. The remainder of the solution, you are going to pour down the cuspidor in order to clean that plumbing as well. The cleaning portion has now been completed. So please wash your hands with soap and water. Ensure you are cleaning as high up on the glove as possible. Depending on the setting you are working, if you are working potentially in an oral surgery, for example, workplace, you may have contaminated the Birex bottle. There may be blood or other residue on there. So please ensure that you do wipe this bottle down as well. And last but not least, you are going to Birex your utility gloves to ensure that they can be disinfected. When proceeding to the disinfection portion, you're going to be using 4x4 gauze. You are still going to be using Birex. The difference is the Birex now needs to sit on the areas you are disinfecting for 10 minutes. Please ensure that it is soaking wet, and once again, you're going to be doing the quite high risk areas. Should your gauze be starting to dry out, feel free to reapply. The reason why you can reapply Birex to the gauze and not necessarily to the paper towels is the paper towels degrade very easily. The gauze, it's a bit more difficult to wear through, so therefore you can just re-wet the gauze. If it starts to break down or there's any pulls, feel free to replace that with some new ones. Once again, all of the handles, all the adjustment levers, all of the switches for the light, you're going to be Birexing and once again leaving it on for 10 minutes. The bracket tray handles, the area where the trays rest, the air water syringe and handpiece, as well as the tubing and the holders must also be completed. Make sure when you're wiping this tubing you go right up to the unit to ensure that you're disinfecting the whole thing. again, you can disinfect the taps as well as the water controls around the cuspidor. Because the cuspidor once again tends to be quite a bit dirtier than other areas, you may want to replace your gauze after that portion. Proceed with the suctions, again including the actual suction piece, the tubing, and the holders. Make sure to take a look around to determine if you have cleaned and disinfected every portion. If so, once again, you are going to wash your hands with soap and water. You want to decontaminate your utility gloves. If you do notice that something was missed, feel free to go back. One thing you need to make sure, other than pouring the Dentazyme down the sections, is also ensure there is no water left in the water lines. With the unit still on, ensure that you spray the remainder of the water that's in the lines out. Ensure that not only are you spraying with the air water syringes, but also the high-speed handpiece tubing. This will remove as much water from the lines as possible to prevent it becoming stagnant and forming biofilms. When completed, you will actually place the rheostat and the foot pedal underneath the chair. This prevents anyone from potentially tripping and falling. You'll notice that the chair has been raised to prevent kinking of any cords. Once again, you will wash your gloves with soap and water, and then you will cover them in Birex. When removing your gloves, please try not to touch the outside of the glove with your bare hands if you don't have to. After, you will hand sanitize your hands prior to removing the rest of your PPE. After the gloves, your glasses, and then your mask. Thank you.